at the Leocora Center. Good morning.
Once again, it's Dr. Ayla Stanford to the rescue.
Stay here. We're going to register you here. We're going to vaccinate you here.
More than a vaccination, this is about dedication.
That was a good shot.
Thousands of shots a day.
How you doing?
About here.
I heard that.
Dr. Stanford and her team are taking careful aim in a war to protect the most vulnerable, fighting a chronic illness that's far more pervasive than COVID. This masked woman is battling social inequality.
I am striving towards equity because 20 years ago when I was in medical school, these same inequities existed.
In Philadelphia, blacks make up the majority of the population and the majority of the COVID deaths. And yet more than half of the people vaccinated are white.
Everyone was talking about this phenomenon of, sort of just frankly, rich folks come into poor neighborhoods and take the vaccine, but no one was doing anything. And the last thing I was going to allow to have happen is for people to now come and take what we built.
We first met Dr. Stanford last April after she became frustrated with the city's slow pace of COVID testing, especially in black and brown communities.
I just couldn't be part of another town hall meeting or watch another webinar or talk about how pervasive the social determinants of health are and not do anything.
In a span of 48 hours, Dr. Stanford, a pediatric surgeon in private practice, gathered some medical friends, her husband, and a rented van, and with the access she had to tests and PPE, they hit the streets, calling themselves the Black Doctors COVID-19 Consortium. Philadelphians came out in droves. At the time, they were lining up for tests, just like they are now lining up for shots.
How's everybody? You good?
Areas long ignored or left behind, getting just the shot of hope they need, where going without one could literally mean life or death. On this day, inside this North Philadelphia church, Dr. Stanford might as well be a pastor. She is ministering to her flock, saving lives, spreading a gospel of sorts to get people to believe.
As a medical professional, we all take an oath to first do no harm and to treat the most vulnerable first.
Hundreds of people waiting in line to get the vaccine from someone they trust. For months, she's had their backs. So now they give her their arms with very little hesitation.
Want to give her a clap for putting this together.
And so for right now, you've just stopped working your normal job and you are single-handedly saving Philadelphia 6 days a week for no pay.
Yeah. I didn't think about it like that, but yes.
And to make sure that the black and brown community in Philadelphia is vaccinated. Why?
Because it should happen, because someone needs to do it, because it's the right thing to do, because it's not equitable. I want to change that. And every day that we get out there, we are changing it. And that's a story I want to be a part of, regardless of if I'm getting paid or not.
Philadelphia, the birthplace of America. But for all the fanfare, it is also the poorest big city in America. And like the rest of the country, it's plagued by racial and economic disparities.
As we know, people of color have suffered the most from this and have had the worst cases and the worst outcomes. Mayor
Jim Kenney recognizes the need and acknowledges the city has had some hiccups in its vaccine rollout.
We had a couple bumps in the road. We are doing really well now.
The city initially allocated vaccine doses to an organization called Philly Fighting COVID, helmed by this 22-year-old who was accused of giving shots to his friends. He says the doses were about to expire. The city later cut ties. Many people pointed the finger at a 22-year-old essentially being in charge of this botched rollout. And so my question to you is, who decided that was a good idea? How did that end up happening?
That was clearly a mistake. There was a history of Philly Fighting COVID when it came to testing. And they did a decent job. They're in the rearview mirror, and we're moving forward in a better way.
So I believe with the Philly Fighting COVID that there was an element of implicit bias where despite there being a reputable group led by licensed physician, that they chose a non-physician led group of young non-medical personnel.
Because you weren't selected, were you then tapping on the mayor's office, or how did you start then getting the vaccines and start getting the word out?
And I simply said, well, why is it available to another group whose track record is not as proven as ours, but it's not available to us? So I pushed hard to get the vaccine in Black and brown communities.
As a result, the Black Doctors Consortium began vaccinations more than 2 weeks ahead of schedule on January 16th.
I feel good since I got it.
The consortium recently hosted a 24-hour clinic at Temple University where they were able to vaccinate roughly 4,000 people in a city that averages 3,500 doses a day. Dr. Stanford, the group that you created, getting a few friends together and your husband and a van, is now outpacing the city of Philadelphia in distributing vaccines. How are you doing that?
It's because we know what it feels like to have a field that's not level, to be treated unfairly for something you have no control over, oftentimes, your socioeconomic status and the color of your skin.
When people are dedicated and determined that they're going to get this shot, then we're going to conquer COVID.
Thanks to a newfound partnership with the city, the consortium recently got a much-needed boost.
They started running a little low. We were able to get additional vaccines that were left over to them.
In the end, it's a win-win for everyone, helping the city improve its slow but steady rollout.
I speak with Dr. Stanford almost every day. She's fabulous. She's high energy. She's extremely intelligent and thoughtful. She's committed to not only the Black and brown community, she's committed to the entire Philadelphia community.
Her steadfast commitment can be measured in the number of rolled-up sleeves, trust in a community that's often said to distrust the vaccine.
It's really unclear to me whether everyone just assumed because of the untrustworthy medical system that people would not want to get it. That may have been part of it.
72% of the Philadelphians her group has vaccinated so far have been Black, nearly 80% Black, Latino, or Asian. At
some point, we might start to see a dip in our numbers, but this is session 20, and we're vaccinating, again, between 400 and 1,000 people a day.
This day in North Philadelphia was no exception. Hundreds showed up at Dr. Stanford's clinic. A mile away at a brand new city clinic, no line. The crowds opting to wait here instead.
And this is Moderna, so it doesn't need the -70. Oh, wow, we're almost out.
Citywide and nationwide, there are questions about why white and more affluent people are getting the vaccine at higher rates. Philadelphia is 42% Black, but to date, just 21% of the shots in the city of brotherly love have gone to Black people. The disparity and Dr. Stanford's reaction to it is making front-page news in Philadelphia.
Isn't that crazy? So it's like you wake up and your picture's on the front page.
Yeah, how do you react when you see that?
I don't know. It feels a little weird.
After all, she's not in it to make news. She just wants to make a difference.
I'll see you in 4 weeks after this, okay?
Okay.
I got to say to my team, look what we did. Not just how we felt, but look what we did. We set out to level a playing field. We set out to create equity where there wasn't any, and we're doing it.
So the outcome is more important than the income.
Yeah, because we are so filled up and refueled every single day with the gratefulness that we get from the community. You can't even put a price on that or value. It's good, and everything we've done from the beginning has come back to us in excess.
Dr. Stanford continues to be such a blessing to that community. More than 16,000 vaccinations and counting.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.